Hello, I'm Ernesto Rodriguez. I'm Director in Chief of Austin Travis County EMS. I'm here to talk about our forecast for 2014 with you. Our organization is made up of 532 FTEs and a total budget of $55.6 million. And there's 5 primary units that comprise the department. The first one is billing services with 18 FTEs and $1.6 million. Emergency communications and operations support includes building and fleet services for 65.5 FTEs and $6.1 million. Support and transfers is the area where we do all of our journal vouchers, where we exchange dollars between departments, and that includes central supply, finance, purchasing, and business analysis. That's 41 FTEs for $4.8 million. Our professional practice and standards group is $3.7 million and 36 FTEs. And this is where we conduct our cadet academies, our continuing education, clinical QI, and some of our most innovative programs in community health paramedic programming and community health education programming. The largest group that we have in the department is the operations group, and that is $39.6 million and 372 of sworn and non-sworn FTEs. In the area of performance indicators, one of the most important indicators that we talk about is our response time to priority 1 calls. Our goal is less than 10 minutes 90% of the time. There's no national standard for this. Communities set these on their own. And as you can see by looking at the slide, that we've got pretty consistent performance in this area. From 07 to present, we've improved our response time. We're holding at 91% right now, which is a 1% drop from the previous fiscal year. There is an increase in calls that's occurring at this time. We expect that there's going to be a continuing increase on that. We also think that there's about a 1% reduction that we're going to expect in the year to come. In that, we're going to ask for additional resources to try to prevent that from happening. Another key performance indicator that we monitor is our cardiac arrest survival to arrival at the hospital with a pulse. Our goal in this area is 33%, and we exceeded that. We actually hit 37% in that area. Probably the most important indicator that we have in the area of cardiac arrest is the number of patients who survive to leave the hospital alive. And these are the ones that we refer to as the patients that get to go home and hug their families. The national standard benchmark for that is 9.1% survival rate. Our present survival rate is 12.1%, so we're exceeding the national benchmark in that area. In the area of survey results from the citizen surveys that are performed, we're doing well. EMS has an 87% approval rating in the area of timeliness of response and 86% in the care that we provide. The problem that we're finding in this particular survey group is that 25 to 27% of the respondents had no experience with EMS whatsoever. So what we're going to be doing in the next fiscal year is initiating our very own patient satisfaction survey, where we survey patients that have actually received care from EMS to try to get better ratings on that and a better feel for the service and quality of our care. For our budget forecast, we have certain cost drivers that we're looking at that we anticipate are going to increase the cost by $3.1 million, which is about a 5% increase. That includes areas of healthcare, insurance, fuel, maintenance increases, and some overtime for standby services. Another area that is really challenging for EMS right now is the increase in drug costs. On a day-to-day basis, there's a variety of shortages that are happening nationally, and we're having to pay more for compounding pharmacies to make up the drugs that we use on a daily basis. We see some increases related to implementation of civil service and replacement of some capital items that are coming our way as well. On the revenue, we're anticipating about a 4.5% increase in revenue. That's about a $1.5 million increase. That includes increases in patient billing revenue, although we are expecting some sweeping changes in healthcare funding in the next years to come. We're also going to see an increase in revenue from our contract with Travis County. We're in the process now of negotiating another interlocal agreement with them. And we also have some cost increases related to standby services for special events. That includes events like South by Southwest, ACL, Circuits of America, and the various running events that occur here every weekend. For capital highlights, we have only one, and that's some expansion of some ambulance bays in our stations. Most of our stations are over 20 years old, and we're requiring to extend the bays so that our more modern equipment will fit into those. And at the same time, we're also going to do some ADA upgrades as well. Some of the unmet service demands that we're seeing in the future include continuing education and training for our sworn staff. We need to add $731,000 so that we can provide 48 hours of continuing education for all of our paramedics. In the area of occupational health and safety, we're wanting to add an occupational health nurse to continue to expand our employee wellness services. And this includes things like TB testing, hepatitis testing, immunizations, and health assessments. That's $164,000. We also want to add a 12-hour demand unit to serve in the south area of our community. Currently, 43% of our late calls occur in the southern response region in our community. We also see a climbing utilization rate for our ambulances. That totals at $824,000. We also would like to add some additional community CPR instructors in our community. When we looked at our survival rates earlier, we're looking for ways to continue to improve that. And when we compare ourselves to other communities that are doing better than we are, the difference that we see is they have more people trained in CPR than we have in our community. So we want to add instructors to increase the number of trained citizens in our community. And finally, we want to expand our community health paramedic program. Currently, this is one of our most innovative programs. Our current team is fully occupied at this time. We're fully deployed. 3 more personnel could add capacity to see up to 300 more patients. What we see whenever we enroll patients in this program is a 40% reduction in the use by frequent callers. That's a significant reduction in cost for our organization. That's all that I've got for you this year. I hope that you have questions and looking forward to it.